Hi everybody, welcome to a video on Hyper-Dilute Radiesse in the neck. I absolutely love this treatment for crepey skin or even just preventatively for patients that are concerned about ever having crepey skin. So for this patient, I am just topically, not necessarily topically, but like an injectable topical numbing here of lidocaine and epinephrine just to make the cannula and needle more comfortable for the patient. So a little bit of lido and epi, I let that sit for just a second or two before I poke her with a needle just so that she's as comfortable as possible. And you'll see too, we're kind of talking as this treatment is going on. It's a very easy procedure. The patient is very comfortable and you can see how thin the skin is for the patient here. So she's on the thinner end in general, so you want to be really careful with a patient like that, that you're not leaving lumps and bumps or anything. You're making sure you're in the right plane. For her, I am doing 3 areas on the neck to try to get as full of coverage as possible. So when my cannula is fitting all the way in there, I want the other side, her right, my left, to also reach and kind of meet where I just finished on this side so that I can get even spread throughout the whole neck. So I'm just working my way through. I did add saline, which is what makes it hyper-diluted. It's not regular Radiesse. And I'm just working my way around. And then you will see I will do the second and the third site as well. And I'm just getting even spread here. Perfect. And you can see how much is just kind of settled too. So we are in the right plane and it is a lot of water, so it will settle. It's very easy to get into the tissue for this patient. I almost want it to be a little bit more challenging. I want there to be more collagen. So she really is a prime candidate for this. And she's going to really like her results. I will see her back for her second and third treatment. I will see her back 4 to 6 weeks from this current treatment, and again 4 to 6 weeks after the second treatment for the final. So it really does take time to build collagen and see results. And getting in there and to the tissue should be harder as time goes on too, because she's built more collagen. So I'm just creating my porthole. And I'm going to do the exact same thing that I did on the other side. And because we're using a cannula too, it is a safe treatment. We've added so much water as well, so this is a very safe and effective treatment. And the patients don't tend to bruise horribly because I'm not poking around with a needle. So keep that in mind too. It might be nice to do this treatment in the winter. Maybe they aren't, they can wear a turtleneck or they can cover up with a sweatshirt. So that's an option just to educate your patient on. So this is hyper-dilute in the neck, and this is her first treatment, and I'll see her back in 4 to 6 weeks. And I'm just giving a nice little massage to just kind of move everything all around and kind of calm down the neck after I've poked it. And that's it.